out the UpScale, and this is pretty neat device. Most of the time, I have to accommodate to my environment instead of the environment accommodating to me. And this scale really allows me to just be who I am and to be treated well like the environment is made for me.
The problem that this solves is plain and simple accessibility. I go into doctor's offices and I have yet to have an exam where I was on a table. Out of all my doctors, I have not been on a table to have an exam because none of them have an accessible table. I go to an orthopedic one day for a problem in my hip, and he's got the old wooden tables that are about, yay high. And he looks at me and he says, "Well, jump up on the table and we'll examine you." And I said, "Well, I can't get up on that table." "Well, I've got quads that can get up there." And I said, "Well, that's fine, but I can't get up on that table. I can't do that transfer. It's not going to happen." I said, "Technically, by law, you're supposed to have an accessible table." And he looked at me and he says, "I don't care. Go ahead and effing sue me. It's cheaper for me to pay you off than to buy a new table." I go into a doctor's office and he's prescribing medication to me that's directly affected by my body weight, yet he doesn't know, he's never weighed me. He's never been able to weigh me. So all he's taken is my guess for it. The weighing, to me, is more important than getting up on an exam table. Though getting up on an exam table is very important, but the weighing, like I said, you're issuing me medication that is directly impacted by my body weight, and you don't know what my body weight is. It's a little bit crazy to me.
In the past, doctors have asked me because I could stand a little bit to go on a scale, and the nurse would be there supporting my weight, and I got this little scale with the tippy bar, and I'm trying to hang on to this bar, and it's shaking and rattling, and how do you get an accurate weight? I've never had an accurate weight, to tell you the truth. Or I'll sit on a small scale on the floor, cross-legged, and my limbs leak over, or I touch the floor. So really difficult, and it kind of seems like an extreme measure just to get a weight.
But I could transfer onto that from my chair with no problem. The way this table adjusts up and down, like right now, it's at a perfect height for me to transfer over.
Because you can take this bar off. First of all, there's no obstruction for me getting from the chair to the seat. Now I use my arms to get around, and so it's very easy for me. In the past, that's been very difficult just to get on the table, regardless of it being a scale or not. So this is very easy because it goes up and down. It has a little remote here that allows that to happen. So yeah. And I have some friends that are in Hoyer lifts that I know that would have no problem getting on this because you can get them in a Hoyer lift, take this off, put them on. And the design is done in such a way that the Hoyer lift can slip underneath the table. So it's a good design. I'm good. I'm good either way. And I don't put brakes on my chair, which I'm told it's not good. Yeah, that's just.